we're going to be able to start the video. Should we industrialise the production of healthcare? It's 9 p.m. in Dr. John Edward Overwork's surgery. This GP has been treating his patients one after the other all day. This morning he diagnosed a bacterial meningitis in a little 7-year-old girl, undoubtedly saving her life. But right now, after finishing up all his paperwork, he still needs to sweep the office. Indeed, just like more than 1 out of every 10 doctors, Dr. Overworked also does the cleaning in his office. After 9 years studying and 10 years of practice, he's still washing the floor himself before closing up. You can be an excellent doctor and still be a terrible manager. Some have a conception of the production of care that reflects their training as medical professionals. They leave medical school with a knowledge of the rarest and most serious diseases and yet find it insurmountable to hire a cleaner or a secretary. Trapped in a logic of income versus expenditure, doctors don't consider investments the way the rest of society does, and 2/3 of them, for example, don't even accept credit cards. Not to mention the poor use of information systems. What French doctor's office is able to draw up a list of patients who are up to date with their vaccinations? The expression to industrialise the production of care makes people frown as they imagine robots taking over. And yet it is the best way to promote an efficient organisation of patient care by actors who can then focus on their core activity. People in disorganised hospitals keep saying that we must hire more professionals, and yet they forget that in the last 30 years, the number of doctors in the French public hospitals have tripled without improving the situation. There are more and more nurses, and yet everyone is still complaining. In hospitals as well as private practices, the industrialisation of care would undoubtedly have a better reception if it were believed to meet the ultimate need that both doctors and patients can agree on: to give healthcare professionals more time to devote to actual care.